And welcome back to Health View. This is Dr. Angela Ruff, and again, our guest this morning is Dr. Richard Weisler. Before the break, we were talking a little bit about some of the PTSD symptoms that can happen even before some of the soldiers are deployed, and you're talking about some of the screenings that they can do to find out if perhaps they'd be at risk for that, and counseling or treatments they may need before, I guess, being deployed.
Yeah, and also, again, when people come back, it's very important after deployment to take a look at this and to have the family be aware, because many times it's hard for the person who has depression or even PTSD sometimes to recognize it, especially depression.
Well, do they do that automatically now?
Well, a lot of times they do. They do a screening, but sometimes what I hear is that people will not be totally honest or may not be totally aware of what has happened, and they just want to get back and see their family or see their friends. So they'll answer the questions pretty quickly, and then sometimes these things develop over time. So, again, with the acute stress disorder, it's in the first month after a trauma, and then acute PTSD would be in the first 3 months. But some people will have it develop chronically, in other words, after a 3-month period of and it will just show up at a later date.
Right.
But I think families, medical doctors, clinicians, as well as the person who experienced the trauma, need to be aware and take a look at it. And there is a special checklist for PTSD that they can ask, particularly the veterans can ask for. It's PCLM is what they call it for military personnel, and it's a PTSD checklist. And I think, the other thing to be aware of is there may be a little bit greater risk for women percentage-wise than men, but not a whole lot of difference. Depression certainly is more common in women than men, about 2 to 1.
It seems like in the news we hear that even though depression may be higher in women, that usually the men are the ones who do have violent acts against other people.
Yeah, it can sometimes happen either way. Most of the time with mental health problems, violence is not all that common, but it can be, especially if they're untreated. And in particular, if, again, they will self-medicate and they're drinking and using drugs.
So it's not necessarily a mental health problem if you...
Well, it can be, but the substance abuse and dependence can be a big part of it, too. And, the important thing is for everyone to be aware and look out for symptoms of, again, depression or mania or hallucinations that sometimes occur.
How would I'm just trying to imagine a spouse. She's certainly missed her husband being gone, and here I'm being sexist. I'm assuming it's the man that's a soldier. Right. So, but just imagine, put myself in her position. If somebody with post-traumatic stress disorder seems to be anger more easily, it just seems like it might be difficult. How would you best suggest to approach that subject?
Well, one thing that's important, like I said, sometimes people will be drinking to deal with the stress. And,
right.
It's usually a good idea not to try to argue with somebody or educate somebody when they're drinking or using drugs. But if you catch them at a different time and point out and you show that you're concerned and you care, and as a family to try to do an intervention to get them help. And, there are resources available both within the military and outside the military for people to get treatment. And, again, there is that concern about the unit leadership might treat people differently or mental health care costs too much or things like that. But the important thing is these, by and large, are treatable disorders for people. And violence is pretty rare. It gets a lot of press. There's no question. And but suicide is all unfortunately too common. And that's one reason why we encourage people to get treatment earlier, because, like I mentioned, 90% of people who die by suicide have a diagnosable mental disorder that's treatable in most cases. And the therapy, medications, lifestyle changes, not drinking, etc., can really reduce those risks pretty dramatically. If people have traumatic brain injury, then they have to be aware that PTSD and traumatic brain injury go together quite a bit. In fact, about 27% of people will have both. And there was original thought they couldn't go together, but the PTSD can sometimes exacerbate symptoms of traumatic brain injury. And at the same time, traumatic brain injury can make it more difficult to do some of the cognitive functioning and cognitive therapy. So you might need to look at that. Now, we haven't really talked about medications, but we do have medications that can help. They're antidepressant medications are sometimes used to treat post-traumatic stress disorder, and there are a number of those that have been approved by the Food and Drug Administration for treating post-traumatic stress disorder. They tend to work a little bit better in civilian population, but they work in the military population as well for a lot of people. And again, ideally, in most cases, people will get some kind of combination with cognitive therapy will help them reprogram the thinking and help them deal with those symptoms of depression or PTSD that we were talking about earlier. And when you put the two together, we get much better response rates. And then the substance abuse, again, it just really complicates things. So,
so if they could have a medication along with the counseling, then hopefully they'll avoid the substance abuse.
Right, that would be what you'd want to do. And again, try to work on things. So if you're a family, if you can get your spouse or child or whatever to, again, like I said, eat right, exercise, not abuse drugs or alcohol, try to share experiences and talk some. A lot of times they don't want to do that right away, but over time that frequently will improve a great deal. If you look at people who are drinking, that definitely makes it much less likely for people to respond well. And so we know that that's not the way to go. And in terms of other medications, there's research looking at other medications as well that might make a difference with post-traumatic stress disorder. I know the military is doing some research with a compound called D-cycloserine, which, interestingly, Angela, is a drug that was used as an antibiotic for treating tuberculosis. And oddly enough, it allows people, and at least in the theory, to learn things more effectively and unlearn some fears more effectively. So whether or not that'll work in larger scale trials, it's unclear, but I know the military and some hospitals has begun doing some research looking at that.
And that's a type of antibiotic originally used?
Yeah, it's actually a type of antibiotic that was used to treat tuberculosis. And again, it's still preliminary. It's not approved by any means. But that's one of the new approaches that's being explored.
Boy, that's interesting to go that route, for something that I think most of us think is psychological.
Well, you would think so, but actually it turns out the very first antidepressants were a class of drugs called monoamine oxidase inhibitors. And oddly enough, they were discovered back in the early 50s when they were doing a trial looking at a treatment for tuberculosis again. And one of the reasons we think this is the case is there's a system called the monoamine oxidase system, which is what breaks down dopamine, serotonin, and norepinephrine, which are three chemicals in the brain that regulate a lot of mood and anxiety symptoms. And the genes that code for that system came to us, it appears, in part from bacteria years ago. And so when you get really depressed or have PTSD and things like that, you're more prone to have infections. We also know that depression can raise the risk for heart problems or strokes or memory problems later on. So again, treating it early can make a big difference. The untreated depression, which again is also very common, goes along with PTSD quite a bit, it can be as big a risk factor for heart disease as smoking or cholesterol.
Wow.
So I would just encourage listeners, either for themselves or their families, to think about seeking out treatment. If they have a problem, talk to your family doctor, talk to your minister, talk to your loved ones. Go, if you're in the military, you can go talk to somebody or go seek treatment to a mental health provider.
Dr. Weisler, if somebody would like to contact y'all, are you accepting new patients?
Yeah, in certain situations we are. Our number is 919-872-5900.
Okay.
But I think the important thing is there's a lot of reason to be optimistic, and the important thing would be to take steps to get the help that you need,
right,
or that your loved one needs.
There's a website for the military. It's called Military One Source, and so if people listening would like to contact them, and then that would give them some more contact information for military related about getting some PTSD help. And there's also a PTSD information hotline, and that number is 1-802-296-6300. Dr. Weisler, thank you so much for taking time
delighted as always. One other number I'd like to give out. There's a National Suicide Prevention Lifeline number, which is 1-800-273-TALK. So 1-800-273-TALK, and it offers immediate assistance for people around the country if they're having suicidal thoughts or things like that and need help.
That's great.
Okay.
Thank you so much.
Pleasure.
I really appreciate your help, and it's been a pleasure for me.
Okay.
Thank you.
Thanks so much.
Bye-bye. And you've been listening to News Talk 640 WFNC. This is Dr. Angela Ruff with HealthView.